Hello, and welcome to the monthly Nurse Linda webinar. We're a little bit early this month because of the Thanksgiving holiday, so I'm happy you could join us today. I am Nurse Linda. I'm a lightly pigmented skinned woman. I wear pink, slightly pink framed glasses. They kind of match my skin tone. I have brown hair with some silver strands, and today I have a teal sweatshirt on because it's so cold outside and I'm trying to stay warm in the house. And the Reeve background is a navy blue background with orange, yellow, and red triangles. So it's kind of fancy. But anyway, we're here today to talk about paralysis. And I do have something I want to alert you to. We've been talking a lot about the new Onward ARC uh, program that the Reeve Foundation has worked in conjunction with several companies that are working with these new spinal stimulations that are external to the body. I call it now. This is the simple version. It's much more complex in its function, but what it looks like is a piece of tape that you tape to the back of your mouth, or back to your mouth, to the back of your to your back over your spine. You can do it in the neck down to the shoulders, or you can do it lower in the body. And um, they have released their product. So it's released to the community now. You can go get one of these products, but they were only in uh, rehabilitation hospitals because this is such a new product that they have to educate physicians on what the product does. And what it does is it provides some electrical stimulation directly through the skin. So it's on the outside of your body, no surgery involved. And it transmits these electrical uh, signals directly to the spinal cord. If it's in the upper part of the body, it helps with hand function, breathing. It does helps with your upper body muscles, maybe some arm function. The results that you get is different for everybody because everybody's injury is different. And the time that it takes for it to get in motion, working for you, can be variable. So it had been allowed only in therapeutic settings, but we knew that it's a device that's been specifically made that you can use at home. And so just I want to say like on Monday, I think it was Monday or Tuesday, we just got an email that now it is going to be allowed in people's homes. So you go to a rehab facility, learn how to use the device, and now you'll be able to take it home. Now it's not available in every single place in the United States or in the world, but they are planning to distribute it all over the world. They're distributing it here in the United States. So if you go to onwardmedical.com, you can get more information about the device. Now, I wasn't on their website today, but I've been on their website in the past, and they do have the price point listed there. I'm not going to quote it because maybe it has changed, and I don't want to give the wrong impression. So if you go to onwardmedical.com, you can find out about it. Now, there are several
I
other
just want
uh,
to give you it's onwd.com.
onwardmedical.com, right, Zach? Because it was
The
just onward at the beginning, and then there was
the
some kind of
Onward
naming.
Medical website now is onwd.com.
Oh,
And I'll put it in the
and
chat.
okay, okay, great. Because I want you to get there. When I go to it, I put in onwardmedical.com and it comes up for me, but we'll go to the officially known website. So Zach will have that in the chat for you. And that will be very helpful. Now, there are several other companies that are doing the same process. And Spinex is a company out in California that has a pediatric version. Right now, it's only available for children with cerebral palsy, but it's the same process. They're different devices, so they work a little differently, or I don't know all the intricacies, but it's kind of like getting the same point across it, increasing your movements. Now, I always like to point out because I'm Nurse Linda and I like to tell the truth. And This is a very exciting product. It's one of these things that people have worked on for how many years? I mean, Christopher Reeve started with the functional electrical bike, and now it's evolved into this. It went from the bike, it went into surgeries where implants were actually put in the spinal canal. Well, surgery is pretty dangerous for everyone. But if you have paralysis, you're at a little higher risk factor. And so, it was like, well, this is really exciting, but it's kind of like a big deal to have this. Well, now this is on the outside of your skin. So you see constantly making improvements and it will continue to get better. But as I am always honest with you, a lot of times people hear about this and think, oh, wow, I'm going to be all better. You will be improved. Most people, now everybody reacts differently. So some people get movement the first day they have it on. It's like, oh my gosh, this is a miracle. And some people, it takes a few sessions to get some return of function, but that's what you get is some return of function. It won't be like it was before. Some people have noticed some improvement in their sensation. Some people do not. It all depends. Each one of us is a completely unique individual. And if you have paralysis, be it from spinal cord injury, be it from a head trauma, from a stroke, from a neuromuscular disease like Guillain-Barré or muscular sclerosis, or whatever it might be, a neurological disease that's caused your paralysis. Every single one of our insides of our bodies are just a little bit different too. Every injury is a little bit different. And when I say injury, I mean from trauma or from disease. So I always include paralysis from disease as well. I'm always speaking about that as well. So anyway, that's now the Onward EX has now been improved in these treatment centers, and they're expanding as rapidly as they can get people educated, and they're expanding around the world. So it's not if you're from another country, it's like, oh, that's okay. It's coming to a station near you, or what was that old saying, whatever it is. Anyway, we have lots of questions, so let's talk about pressure injuries and wound care. And we had somebody writing in about, are there any new innovations in wound care? And yes, there's a lot of things that have happened in wound care. Wound care is an issue that tends to come up only after people have a pressure injury. Now, if you're a lightly pigmented skin person, you're if you get a red spot over a bony area, or if you have like a splint that you're wearing and it's rubbing against your arm or your leg, sometimes if you wear a leg bag that you put on, and it has those straps that go around your calf or your thigh, and you put the leg bag on empty, so you put it on with a certain amount of tension so it doesn't drop down off your leg. But then as the bag fills, the bag becomes heavier when urine's in it. So the pressure on that leg strap changes, and sometimes people will get a pressure injury from that leg strap rubbing up against their legs. So, you know, but I shouldn't say rubbing, I should say putting pressure on your legs. So sometimes a little ulcer can develop there. So you can get them all over the body. Mostly they appear in bony prominences. And we have this wonderful skincare book that has a picture of a man with circles where the prominent places where the bones are closer to the edge of the skin. So, for instance, we all know, like where we're sitting, we have some pelvic bones that you can't see, but they're in there. And when you're sitting, you're putting pressure on these two pelvic bones, and the tips of the pelvic bones are like little points, and that's just like a little drill going down into your skin. We know that people get them on their hips. We know that you get them on your ankles, but if you have paralysis of the arms, you can get them in the elbows. You've got a little bone that's prominent here. You can see mine. You can get pressure injuries there. You can get them on all your knuckles. You can get them on the back of your head, your shoulders. You can get them. I've seen them where people have had it on every single vertebrae of the back of their spine. And so the way you prevent them is doing your pressure releases. So you have to be able to move your body either from side to side, forward or backward. You have to be able to do your push ups in your wheelchair. You have to be able to turn yourself or have somebody turn you at night. Now, everybody should have medical grade pressure dispersing equipment, and that's usually a cushion of some type or sort. It might be foam, it might be gel, it might be air filled. Some of them have pressure dispersing that they move around. And so those are very, very helpful. They greatly reduce the risk of your pressure injury, but they do not eliminate it. You absolutely have to do your pressure releases. Now, when your body is younger and healthier, people tend to have less pressure injuries. As we get older, our skin, no matter if you have paralysis or not, but with paralysis more so, your skin can get a little bit thinner, your muscles can get a little bit thinner. And so, you can always, you have higher risk as you get older. So you have to be very careful. The way to treat a pressure wound is to not get one in the beginning, because once you have one, the way the body heals itself is to make a scar. So if you've had a pressure injury, even if it's just a red spot, because the capillaries have broken over a bony area, you might have a red spot or a purple spot, depending on your skin tone. And then you want to stay off that area until that is relieved. Because if you sit back on that area or you put the pressure back on that area and that spot has not gone away, your internal body has not yet healed. So sometimes that can be kind of a bit of a uh, uh, snag in life, because if, say, you get one from sitting in your wheelchair and you're sitting there and you think, okay, well, I'm going to lay in bed, turn from side to side so I don't put any pressure on these spots. But then I think, oh, a lot of times people say, well, I just got up to brush my teeth. Well, I was in my chair just for 5 minutes. That wouldn't have done anything, would it? Yes. The minute you put pressure back on that spot, all that time that you've stayed off of it has just been negated because it's not healed. So you've just redamaged it. You're starting over from square one. When they get really bad, sometimes you have to have surgery. So sometimes people will have these wounds for years and years, and when they go into a great length of time, we call them chronic wounds. And you can usually tell a chronic wound because when you have a wound, say the wound's over here, and the edge of the wound will look a little more rough, a little more raw, a little more ragged. You don't want the skin to close over the top of the wound. It has to heal from the bottom up. If the skin closes over the top too soon, that will enclose the wound inside your body. You can't put treatment on it because now their skin is closed over the top. And so it kind of festers in there. And so it starts growing out bigger on the inside. And so we keep those wounds open with dressings placed in, in a way so that the wound won't close up, so that we can heal that from the bottom up. But when you look at the edge of that wound, if it's a fresh wound, and it's open, so it's beyond the purple spot or the brown or the pink spot, it's open now. And so when that wound is new, it kind of has a rougher edge. It might look smooth, but it's kind of more of a looks more like a fresh cut, looks more like a fresh wound. When a wound becomes chronic, this edge will start to curl under like this, and the skin starts curling under like that. That is when a wound really becomes chronic. Those are much harder to heal because the skin now is going to start growing this way instead of when you're finally ready for it to grow across the top of that wound. Sometimes that has to be trimmed by your healthcare professional only, um, to get that skin to be fresh that it can grow across the top of that. So there's all kinds of different things, but what kinds of things? I have this huge list of new things. So new things that are going on to help your wounds is there's new kinds of medications and treatments that you can use. So there's new biomaterials where they're using collagen, hyaluronic acid, and other substances. Now, what do those sound like? If you listen to TV and you hear about women and their facial care products, what do they hear? Collagen helps the skin, hyaluronic acid helps the skin. And so you hear about these things. So now they're doing studies, and there's some products that are available now There's also something called scaffolds, which I find fascinating because if you go by a building and you see somebody painting a really tall building, you'll see scaffolding on the outside of the building. So that's exactly what we're talking about. But there's treatments that that create scaffolds that are almost microscopic that can go inside the wound so that when you have that healing from the bottom, it can the healing can kind of work its way up the scaffold till it gets up to the top. Now, how cool is that? They also have scaffolds. This is a side note that they can put inside the spinal cord because when you have an injury in your spinal cord, they'll put in this stuff called scaffolding, microscopic, and it helps regenerate if they're doing some kind of, I'm going to go ahead and say it's stem cell or other kind of treatment to help the spinal cord injury heal from the inside out. So the scaffoldings help populate that whole wound on the inside. Kind of cool. So scaffolding is very good. Very cool. These are all new things. And so you might not be able to get this kind of treatment just anywhere. Some of these are in experimental form, some are ready to be used now. There's some protein enriched products that people are using. And then there's this thing called a micro mist, which is like a little, I'm going to call it a spray for lack of a better word, but it's microscopic, and they kind of spray that um, into the proteins and antibiotics and different substances into the wound, deep into the skin and into the tissue to promote healing. And they're looking at that to prevent infections as well. So that's very cool. Now, something that's been on the market for a while, but shockingly should be used more than people get, it's called negative pressure therapy. That's a wound vac. It's offered in some places, and in some places it's not. Now, it's available everywhere. It's a national company. It's called Wound Vac, and you can just Google it in, and the company will come up. It's for those deeper wounds that maybe have some exudate, and they put plastic on the wound to provide a barrier. And then there's actually a suction device, like a vacuum, that goes on onto the through this plastic the wound. It stays on for 2 or 3 days at a time, and this vacuum is constantly drawing any kind of uh, debris that the body's trying to get rid of. So if you get too much debris in a wound, sometimes people use wet to dry dressings. That's one of the more traditional and one of the basic things. And you put in a piece of gauze into the wound that has some sterile saline on it. And you put that into the wound, and then you pull that out as it dries. The gunk of the wound gets in that dressing, and so it kind of pulls that gunk out, because if you get too much gunk in there, then it seals off that wound, and it allows infection to be sealed off in the wound. So that's an old treatment. The wound vac is a newer treatment, but it's been around for years. And sometimes people will ask me about, is there anything more they can do? And I'll say, well, there is this wound vac. And so they'll be like, "Oh, I've never heard of that." And I'm always kind of like, "Really?" But yet I know from working in a variety of different places and different settings that it's just not offered everywhere, and it should be. Now there's oxygen therapy that's also being done. There's hyperbaric chambers that you can go in. Sometimes they just put a device over the wound itself to put a lot of oxygen into the wound to help provide that oxygen that's needed for healing that. And then, of course, there's all kinds of um, equipment that can be used. So you want to get a good pressure dispersing cushion and bed overlay to make sure you're on the right thing. Now, there's a variety of kinds, and everybody will ask me, what is the best one? But what is the best one? I want the best one. And there is no best one. It depends on what your skin is, what your age is, if you have a lot of weight, or if you're very thin. And being of normal weight reduces your pressure injury risk. Being overweight, because fat collapses, it doesn't disperse pressure. So that can increase your risk, but being too thin also increases your risk because what you want is a big, healthy, juicy muscle. That's what really works in the body to help with your pressure, keeping those bones well padded so they're not drilling from the inside of your skin to the outside. By the time you see something on the outside of your skin, you already have damage on the inside of your skin. So, you really have to talk to your therapist who will, and your healthcare professional, and they will tell you what is the best cushion for you in your situation and your body. And you have to do those pressure releases. So that's very good. Now, some electrical stimulation is being put. We're using e-stim on everything these days. So electrical stimulation is another thing. Some laser therapy has been developed. Um, but don't overlook something that everybody has in their healthcare policy, as far as I know. Now, there's always some policy that, doesn't have it. A bare bones policy might have it. But as often as you can, check your policy. And as often as you can, ask for a nutrition or a dietary consult because it might be different with your paralysis than it might be for someone else that can help you with, oh, I'm not moving, so I'm putting on weight, or I'm too thin, maybe because I have a lot of spasticity or tone in my muscles, so I burn a lot of calories and I eat well, but I'm getting too thin because your muscles are being used through your spasticity. Some people use their spasticity to help them transfer, so they don't want it to be completely gone. But, there's all different kinds of things. They can tell you the amount of protein that you need. If you need, more of this or that, your healthcare professional, when they order your blood tests, can do a nutritional analysis with a blood test that will tell you what your protein currently is, what your calcium level currently is. All these kind of things will help. If you have a pressure injury, you're going to need a different nutrition. You might need more protein. You might need more of this uh, uh, supplement or that supplement. Now you'll say, "Well, which ones are those? Because I want to start taking them now." But you don't need them now. You don't want to take supplements just because they're out there and they're on the shelf at the grocery store and I can buy them. I don't need a prescription. You don't really want to do that because you can get too much of supplements. So you have to be careful to keep your chemical system all in balance. So it's best to have somebody who's monitoring that so you know what you should be doing. And then, of course, if you have an infection in your wound, you want to get either antibiotics that you take by mouth, or sometimes they'll put antibiotics that, like you put on your skin that can go in the wound and treat those pressure ulcers. Because if it gets infected, it can travel to the bone. And then once it's in the bone, it can travel through the marrow, and then that infection can go throughout your body. So lots of things to think about there. Now we have Leon. Hi, Leon. Has a great question here. What's the best way to treat scar tissue from a previous pressure sore? And that is a very interesting question because people think, okay, now my pressure injury has resolved itself, my skin's all closed, I'm ready to roll. You have to start building up your pressure tolerance. Remember when you first started your rehab, you weren't just put in the wheelchair and you were there all day. You'd have rest periods. You'd be in the wheelchair for an hour and then they get you out of the wheelchair and check your skin. Maybe in a few days you could go up to an hour and a half in the wheelchair. So you have to build up your pressure tolerance because even if you have just a spot on your skin, on the inside there's still that scar. And so, what can you put on that scar tissue? And what you want to do is scar tissue does not have stretch to it. My skin and all of our skins very, very stretchy. Um, Look at, I'm well hydrated because if I was dehydrated, this would stay up without pulling it. It's kind of a little trick you learn in nursing school. Is this patient dehydrated? But let me see. So you kind of know that. But regular skin, it has to stretch. It has to go over our knuckles. It has to go over our elbows. Our skin stretches so that when we're seated, it stretches to conform to our body needs. Skin's such a wonderful organ. It's so fascinating. So, when you have any kind of pressure injury, even if it was a spot, if you had an open one, you're going to see a scar because that's the way our skin heals. It creates a scar. In fact, all parts of our body create a scar. So, if you've had a head injury or spinal cord injury, in that spot where the injury is, the body creates an internal scar. You don't see it, but that's what happens. And so the body says, hey, something's wrong here. So we're going to wall it off, and it makes a scar internally and externally. So there's a cream that you can buy over the counter at, just at the drugstore, and it's called Scar Cream, and you can rub that on there. Now, there are different people who might recommend different vitamins to kind of soften the scar. Once the scar is there, it's not going to have the same elasticity as your regular skin, and you're going to have to be much, much more careful no matter what. You don't want the scar into a callus because callus also doesn't have that stretch. So if you have a callus, sometimes people will get, if they're not using their hands, or if they're not using their feet with mobility. Sometimes people will get calluses, and people say, "Oh, I'm going to get that down." If you go to one of those manicure places and you have a little callus or something, they take out that razor. Don't ever do that. Do not ever do that. The way you want to reduce a callus, you want to get rid of your calluses because it doesn't stretch. So you've got a tight spot in your skin, and that's going to affect the skin next to the callus anyway. It's all, all fits together. So don't ever cut a callus. What you want to do is you want to soak that area where the callus is. Soak it in some warm water. Let it sit there for 5 or 10 minutes, and then just take a wet washcloth and just buff the area. And slowly over time, that callus will reduce. The reason why you want to do it slowly is when you have a callus, the skin underneath is real tender. It loses our skin faces the outside world. Our skin is pretty tough material. And so if you take off a callus, that skin underneath that callus has become very soft and very tender. And so it breaks down even easier. So if you completely, rip off a callus, you're going to have a lot more trouble. A lot of times people will pick at their skin if it starts to flake. That creates little microscopic openings where bacteria gets in. So after you do that, you want to put a lot of emollient lotion on your calluses. You want to put emollient lotions on your skin to keep that flakiness from happening, and that really helps. And we have a comment from Milton, who used the wound vac at the Stokes VA. Yay, spinal cord unit. Been there many times. Love it there. And it does a great job in helping healing wounds. And it really does. And it's often overlooked. And I don't know why. If you talk to the people at the wound vac, they will help you with your insurance to help get it covered by insurance. I think because it's like I say, it's not new and novel now. It's been around for quite a number of years, and they made a lot of progress. But I think because it was new and novel, sometimes payers didn't want to pay for it. It's another layer of finances and stuff. But yeah, the wound vac is really good when you need it. So if you have a red spot, you don't want the wound vac on it because that's closed wound. But if you have a dirty wound, it's really kind of nice. Now, the one complaint that I've heard about it is that you always have the vacuum with you, and it makes some noises, and they've worked to lower how loud the vacuum wound vac is, so you don't hear it as much as you used to. So, tell them, this is bothering me. It's too loud and noisy, and they'll work on it and get it fixed as best they can. And so, anyway, that's something about wounds. So, I went on quite a bit about that. Okay, so here's somebody who had a foot X-ray, and they found out that they have osteoporosis and hammer toe deformities. So their toes are kind of getting curly. Any tips on foot care for those of us who can't feel their feet? I wear shoes all day, every day, which is great because that keeps your foot in position. But you have to move all the joints in your body every day. And that's one of the things that I see with working with people in the community. I'll say, do you do your stretching? Some people call it stretching, some people call it range of motion. But do you move your body where you're paralyzed every single day, a couple of 2 times, 3 times a day? Do you do that every day? Oh no, it's so boring. And it's hard to lift my body parts or something. And so, but you have to do this every day because your body is craving movement. Your muscles are craving movement. We have muscles that push things in our body, and we have muscles that pull things. The muscles that push are a little bit stronger when we use them than those that pull. But when we're not using them, the muscles that pull will pull and start these contractions. So by the toes curling in, they're starting to get contracted. So you have to move the toes. Sometimes we move them all together, but you can see when I'm moving my fingers all together, this one kind of falls out of reach and doesn't quite move up with the rest. So it's best just to move them all through the whole range of motion and stretch those out, every single muscle. If you have some arm function, but you don't have leg function, there's these things called loops. Now, you've all seen the transfer belts in the hospital. So think of that material, but it's about an inch wide. And you Velcro these loops. You can buy them on the Amazon or whatever. Um, so if you use, you put these loops around the thigh or around your shin of your legs, and then they have, so those go directly around, you have clothes on, so you don't want to be rubbing against your skin. So you put those around your body, but then there's a loop, a big loop that's also attached to the side. That's where they get their name loops, leg loops for exercise. And so you have these. So if you have that, you can put them on your legs and then you can put your arm through one of the loops. And if you have a little bit of arm function, you can pull up your leg and exercise your leg. There are also different treatments you can do if you're fortunate enough to be able to get an FES bike that helps with the lower body. But don't forget, you have to do your upper body too if your upper body's affected. And people will tell me, "Oh, I exercise all the time." And well, what do you do? And they'll say, "Oh, I go to the gym and I work out my triceps and my biceps and I'm doing this and I'm doing that." What do you do for your lower legs? Oh, those don't work. So I don't do anything with those. Well, you have to do that. If you have function, if you got reciprocal gait orthotics, RGOs, if you have a little function in your legs, and people get those and they think they're going to be up walking around, and then they do that for a while and they say, oh, wow, this is really too much work because standing and moving your body with paralysis because of coordination and proprioception is very difficult. And so people get their RGOs and they don't really use them. But if you have them, that's a great exercise for your legs. So if you can't do it yourself, you have to get somebody else to move your legs for you and your arms if you don't have arm function. So it can be a challenging thing to do. If you go to the Y, you might have access to different exercise equipment. They have trainers. They might not have any experience in paralysis whatsoever. But I know at the Y, they have special programs for people with MS. They have special programs for people with Parkinson's disease. So if you have paralysis for spinal cord injury and from brain injury, talk to the people who are doing those classes and they might be able to modify their class for you. So that's a pretty inexpensive. If you're of a certain age, you have silver sneakers and you might be able to get into that class off your silver sneakers from Medicare. So those are all different kinds of things that you can do. It's the end of the year, so it's kind of late now to try, but at the end of the year, I always like to tell people, like in September, and I've talked about this before, if you have health insurance, almost everybody has 2 weeks of mobility training in their health policy. Medicaid has it in states. So just about everybody has. You can check your own policy or you can go and ask somebody, if their services are covered. And then you can go for 2 weeks for mobility training, which can be a lot of different things. Mobility training might be learning how to feed yourself. Mobility training might be learning how to exercise your legs so that eventually you'll become more mobile. So it can kind of be massaged into different things. You have to be a little bit clever with that, but that's a good thing to do there. Why does my body get stiffer when it's cold outside? Because everybody's body gets stiffer when it's cold outside, if you have paralysis or not, because our muscles contract in the cold weather. One of the muscles that contracts in the cold weather is your bladder. So if you have sensation, you might notice that if you go outside in really cold weather, oh, I have to go to the bathroom. Because when the cold gets filtered through to your bladder, it's going to contract and you're going to say, oh, I have to go to the bathroom. But I just went to the bathroom a minute ago. Why is that? So the bladder does it, but all your muscles in your body do this. And so you have to dress for the weather. I have my sweatshirt on. I have a t-shirt on under my sweatshirt because, just sitting makes you colder. So you want to keep the temperature of your house warm enough. You want to keep it cool enough in the summertime. You might need to turn your temperature up a degree or two because maybe you need just a little bit more. You might want to sit closer to the vent or in the window in the sunlight. But if you have a temperature control problems, you want to make sure you don't get overheated as well. So you're going to need to monitor how you're feeling where you do have sensation and where you notice kind of things or have somebody, if you have somebody with you, they notice that your cheeks are getting real rosy. Perhaps you're a little too warm, so want to be careful. If you're sitting by a fire, sometimes people have one side sitting towards the fire and that side of their body's getting too warm while the other side of their body's too cold. So you have to look at all these things. If you're going to go outside, make sure you're dressed for the weather. I have a new friend who I see on occasion at the high school football. And he goes there and he never has shoes and socks on. And in the fall and towards Christmas time, it gets cold. In November, December, at the end of the season, it's cold. And he's sitting there and his feet are just frozen. And I'm like, dude, you've got to wear shoes and socks. You've got to wear warm socks. You've got to keep your feet warm. He's like, oh, I don't feel it. And I'm like, but your body does. Your body feels that cold and your body's reacting to it. You're going to get frostbite. You're going to lose your toes. And you don't want to do any of that. You want to keep all your body parts always, if they work or not. You always keep your body parts. So just be sure and know. Some people, when they get too cold, they get over chilled. They've been outside too long, or something's happened. They get over chilled. They can't, with a brain injury, spinal cord injury, sometimes with neurological diseases, they can't reset their internal body temperature. And it's really hard for them to get warm again. And they'll get all kinds of blankets on them and they'll try to warm their body. But it's not until they go to sleep and then they wake up again. And then that sleeping allows the brain to reset the internal body temperature. Well, that's fine, but not everybody wants to take a nap in the middle of the day. You got things to do, man. We're busy people. So, but that if you really run into a big problem, sometimes if you can fall asleep for, just even a short time, when you wake up, it's like, oh, now I'm okay. Before you go outside, if you have somebody who's going to be driving you, get your car, uh, have your car heated before you get in your car. Like in the summertime, you want your car cool before you get into the car. So just think about all these things. Sometimes people will have a warm bowl of soup, and that kind of helps warm you from the inside out. But if you keep yourself clothed right, dress in layers because that makes the cold more challenging to get into the core of your body. So those are all different kinds of things. Okay, bowels. We always talk about bowels, but we have some different kind of bowel questions today. So there is a question about prepping for a colonoscopy for their daughter who is quadriplegic with CP, but neurogenic bowel. So she's thinking, is there any practical tips? Well, I do have one tip for you. Check with your healthcare professional, check with your insurance company, because people who have paralysis, they're trying to do a colonoscopy prep. They have neurogenic bowel. They're drinking all the chemical. Maybe they're having to do extra suppositories, but you don't know when that fluid's going to travel through the body. You don't have any recognition of when that bowel movement's going to occur. And then you have to wait until it's clear so you have liquid bowel movement at the end of this. And it's a huge, horrible mess. You can't sit on the commode or the toilet for long enough that it takes the hours of drinking this bowel prep. So insurance companies are allowing people to go to the hospital and have the bowel prep in the hospital where they have people who can deal with this. It's, not you trying to do it in the bed in your house, the stool's all over, you're trying to clean up the stool, and oh, then there's more stool. So check with your insurance company, and that really is the best. That's the easiest. Otherwise, you're stuck at home. Be sure you've got some bed padding in there that you can take that out because yes, when you do it at home, it's a real challenge. So sometimes they'll let you go in the night before, get the bowel cleanse, and then do it. So that's worth the investigation. How can I prevent kidney stones and UTIs? Well, if we knew that, I would be a millionaire. So I would love to tell you the secret. Here's another question that somebody's written in: how to help prevent UTIs as we get older, and they're using intermittent catheterization. So, with intermittent catheterization, you have to watch your fluid intake. And so you can only drink in certain amounts, and that's an issue. But there are new products that are coming that's going to help with this. Now we're real close, and we say we've been real close on something 20 years ago, but these are like going through the FDA approval process. So, and how long that takes, we don't know. So I'm not even gonna say. But it can take a short amount of time, it can take a long amount of time. It just depends on what the product is and what's going on. So if you can't increase your fluid, not by gigantic amounts, but if you can't increase your fluid by little tiny bits of amount at a time, so like maybe in 1 week you want to take one extra sip of water. If you're on intermittent catheterization and you have a controlled amount, you really can't do this. But if you have an indwelling catheter or suprapubic catheter, you can slowly increase the amount of water. Water is the best thing because it flushes out your system. If you drink a lot of caffeine, and I'm not saying you have to give up your morning coffee, but don't drink coffee all day long. A lot of chocolate, because that also gets processed through the body. It has a lot, chocolate has caffeine in it. Alcohol, fruit drinks, diet sodas, sugary drinks, or even if they're diet sodas, bacteria love that. They thrive on that. They can't wait for you to have another slug of that because that's just feeding the flames. So be sure that you are looking at what fluid, what you're eating, what you're drinking. Um, if you need a cup of coffee, okay, fine. If you're out at your cousin's wedding and you want to have one glass of champagne, okay, fine. We have little exceptions that you still have to live life, but avoid all that if you at all possibly can. If you're using that intermittent catheterization, and you're not sitting up to do it, try to sit up because it empties the bladder more completely. If you withdraw the catheter slowly and you're sitting up, because the urine will pool at the bottom of the bladder and you're able to get all the urine out. If there's some urine that's left behind, then that has more opportunity for um, infection. And something that's very important, again, movement. I can't tell you how important. I call it the use the James Bond method. Exercise your legs, move your legs, because that's going to shake up your bladder. It's going to shake the abdominal muscles, which is going to shake the bladder. It's like that old song about the bones, the ankle bone's connected to the shin bone. It's like that. Well, the leg muscles are connected to the abdominal muscles, which is going to shake up the bladder. That's why I call it the James Bond method. You're going to shake that bladder, not you can't stir it. So shake it. So that's an easy way to remember. I entertain myself. What can I say? And on the kidney stones, that's something that comes with certainly your intake can affect that. Movement can affect that. Some people are more prone to kidney stones. Something that's good now, kidney stones don't necessarily go with osteoporosis, but they can go together. So if you have, or if you don't have, most insurance companies now allow people to get a standing frame. You might have to go through a process. If you haven't stood for a while, you're not going to be able to go into a standing frame and be like, oh, look, I'm standing today. You're going to have to get your blood pressure accommodated to being able to stand. You're going to have to maybe elevate yourself just a little bit in the standing frame and then work your way up to a full stand. But in the standing frame, you're putting your weight through the long bones of your body. If you already have osteoporosis or osteopenia, was just one step lower than osteoporosis, but your bones are demineralizing. You want to be able to stand because that puts your body weight through your bones. And with your stretching exercises, with your body weight, that will help prevent more cases of osteoporosis. Do you know that 45% of people with spinal cord injury have osteoporosis within 2 weeks of their injury? 45%. That's huge. This is a huge problem. Why isn't it such a big problem with head injury? Because people can still usually use parts of their body. They might still be walking around. With stroke, they still have use of one side of their body, so they might be walking around. With neurological disease, you might still have some use of your body. That's why osteoporosis still happens to people with paralysis, no matter the source, but that's why you don't hear of it so much, why we have so much more information with spinal cord injury about that. Now, um, secondary and third tertiary conditions um, after paralysis, and there are many of them. So the big three are bowel, bladder, skin. You have to take care of those issues because, like we were just talking about, you can get kidney stones, you can get UTIs, neurogenic bowel, you can get impaction, skin, you can have skin breakdown. But the big three, the most dangerous ones, are DVT, sepsis, and AD, and we have wallet cards for that because many people do not know about these with paralysis. So if you have a wallet card, if it's inside your wallet, it's a trifold. They're free at the Reeve Foundation. Print them off, hand them out like candy. If you go to your healthcare professional, I think I might have this. If you go to the ER because you think you might have sepsis, they're going to start with the simplest thing and work their way up to the most severe thing, which is sepsis. You don't have time to work your way up. Hand them the wallet card. I think I have this. I think I have a DVT. I'm having autonomic dysreflexia. You might go to the ED where somebody, or the urgent care where somebody's never cared for somebody with paralysis. So have those on hands. We have a whole page. If you go to the Reeve Foundation and type in secondary condition, there's a whole pages of all these secondary conditions. And then there's an information sheet about each one of them. Hypertension, hypotension, your blood pressure can be too high, it can be too low. Your weight can go up, your weight can go down. It depends on what's going on. The joint stiffness we just talked about, contractions, osteoporosis. Heterotrophic ossification is the opposite of osteoporosis. Osteoporosis, you lose the minerals in your bones. Heterotrophic ossification, your bone cells, because they're not having the nerve communication that they have, they kind of get lost in your body. And near a joint, they'll grow outside of the bones. And so your joints start getting bone growing around the joint. So your joints won't move. That's why you've got to keep exercising. It helps prevent that from forming. Um, Respiratory issues. Even though you have a lower level injury and you breathe just fine, you might not have as much function in your abdominal muscles or on one side, and you might have of your body, and so you might have trouble breathing. So exercise, 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 and also look at your mental health. So that's very important. Um, Somebody's worried about their debilitating weakness from multiple sclerosis, and they want to know about bearing their own weight. Again, you could get a standing frame if that's a problem. Taking some therapies, and they were on a medication. So at one time, so maybe try some of the medication again because MS has a lot of medication that won't cure MS, but will help your symptoms become a lot less. So look into all those different medications with your healthcare professional. See what kinds of exercise. They have the MS Society, which has a lot of information, as well as the Reeve Foundation has a lot of information about MS because we don't care. If you have paralysis, you're welcome. So we have a lot of information for you. The MS Society, they have meetings that you can go to, which are very helpful. They have places where there are heated pools. And I tell people if you have paralysis and you don't know where the heated pool is in your area and you want to take some aquatic therapy or you want somebody to take you to the pool to help do your exercises because the buoyancy of the water helps you. Sometimes people give private exercises, therapy sessions in public pools. So if you can't find one, you Google heated pool near me. You can't find one, call the MS Society because they know where all those heated pools are. Um, what if you have contractions? It's their equipment that can help. You can get those loops that we talked about earlier. Use that 2 weeks of therapy to learn new range of motion exercises or get some techniques, see what products are available to you. Here's somebody we opened the show talking about Onward Medical's ARC EX. That's that device I talked about at the very beginning. That's the tape that goes down your neck. I'm sure they would shiver if they heard that's what I call it. And they probably know, and they're probably saying, call it that. But that's the simplest way I can put it. And so this person, they've had their spinal cord injury for 45 years, and they're not sure if it would work for them. So there are people who have been doing FES for numbers of years that have had some results. Some people do not. You're going to have to go get out in a therapeutic session to see how well it's working. It might not work for you the first day. It might take a few treatments, but from what I'm seeing of it and the people that I'm talking to about it, is they're having some wonderful successes for it. And we do have the mentoring program at the Reeve Foundation. And I'm sure if you call or go to the Reeve Foundation and look up the peer mentoring program, and I bet it comes up right up here in the chat box any second here. But if you have, you can talk to somebody there that has had this and has done this, and they'll tell you what their experience was. Now, remember, every injury is different, but we would see improvements in people, maybe not walking, because that's people are like, oh, I'm going to do this FES exercise bike and I'm going to walk. Probably not, but it's going to help you in so many other ways. It's going to help you stretch your muscles. It's going to help you do this thing. This is going to improve your function. It's not going to make you like pre-injury, but it's going to improve your function. Now, it's important for everybody with paralysis to learn about these things because as this helps one person with neurological injury, they will expand the horizons. They will do, okay, now we've got information. It's working well with people with spinal cord injury. Will it work with people with brain injury? Will it work with people with neuromuscular disease? Sure. It's all going to, but they've got to prove it first, and that's the important thing. So we talked about osteoporosis. Um, we put some things up about aging right up in the front because as we get older, our bodies age, and aging with paralysis is a little more can be, won't necessarily be, but might be a little more rapid for some people than other people because like I talked about the thinning of the skin and the muscles getting smaller. But if you keep yourself healthy and maintain your health through your younger age, you're going to end up with an easier aging process. So that's important to note also. Something I wanted to talk about, we had a webinar a couple of weeks ago with Dr. John, who worked at the foundation and is a psychologist, and it was all about um, mental wellness and keeping yourself mental well. And I really want to stress this because people talk about mental health, and I see it in people all the time. I'll see their faces tense, I'll see their bodies tense. I'm not crazy. I'm not talking about people with mental illness. I'm talking about every single person on this planet has to have mental wellness. And whenever we have anything catastrophic, like brain injury or spinal cord injury, neurological disease, no matter what age you are. So if somebody gets injured, we have somebody who wrote in, they got injured at age 78. What am I going to do? You really need to talk to somebody. I mean, it's easy for me to say, well, you should do these things, but it's hard to do these things. So you really need to talk to somebody who's able to help you help you walk through this process. There is a thing that developed out of the pediatric literature for children with chronic illness, and it's called chronic sorrow. And it, it started in pediatrics, but it's infiltrated into adults. So you just get your life figured out. Okay, I've had this. Okay, now this is the way it is. I'm moving on. I've adapted to my life, and then boom, something happens. And, "Oh, I can't do that. I really want wait a minute," or, "I've been doing everything right for 10 years. Why am I not showing any improvement?" They give you techniques to help deal with roadblocks that will come up in the future. So they help you deal with the present, but they kinda walk you through different, stages of having a chronic injury or illness. And so it's very important that you get connected with somebody that will help you. No, maybe you don't need it today, but it will help you kind of plan for the future and help you see the future. So these are all important things. Now, we also have the peer mentoring program at the Reeve Foundation. I cannot recommend this enough. I've met a lot of the peer mentors. They're fabulous people. They will match you with somebody with maybe you're the same gender, maybe the same age, maybe you're a caregiver of somebody and you'd like to talk to somebody who's a caregiver like you are. um, the type of injury or illness, they'll match you together. Now, the people they have in their mentoring program are not just people that said, "Well, hey, I'd like to be a mentor." They're given education on how to be a mentor so that if somebody calls them and says, "Well, this is my problem," they're not going to say, "Oh, well, this is what you do, this is how you fix it." They're gonna kind of help you walk through your life, your setting. Now they might say, "Well, I tried this," but they'll also say, "It worked for me." It may or may not work for you, but they'll give you some, or I heard of somebody who tried this thing over here and that helped them. They will try to match you in somebody in your area if possible. And they might even be able to tell you a dentist in your area that has an accessible dental clinic. I mean, you just never know with these mentors, and they have their own little mentoring group that they form together so they keep on top of what's going on in the community. It's a fabulous opportunity. And just because you get assigned to somebody does not mean that your personalities are going to click. And so if you're having trouble, well, I'm just not really relating to my peer mentor. You can contact the foundation, no harm done, with somebody else. It's not that, we're just trying to help and we want to do that. And so if one thing is not working out, we'll try something else and we'll get going with that. Here's somebody who wrote in, and I love this, is that here's somebody who wrote in that says you have to train the trainer on the needs of your workout. And that is really true. So you have to know, people go to therapy and they come home and they're supposed to be doing these exercises and you're given that big book, How to Do Your Exercises, and they're like, "Oh, wait a minute, am I doing this right or am I doing that wrong?" And if you go to a place where they don't have people who specialize in chronic diseases, then you're going to have to tell them these are the things I need, or I shouldn't be doing that, but I need to be doing this. So you kind of have to educate people. Now, there's a lot of videos online. Again, you must use your discretion. Get the videos from a good place like Shepherd Center or Craig Hospital. You can go online. They have videos of how to do different exercises. You can go online and find pictures of how to do exercises. If you have that opportunity to take 2 weeks of therapy to get some, a little tune up for yourself, ask if you can take a picture of yourself and doing the exercises. So, all those things are kind of important to keep track of. Okay, and then, basically just keep moving. Keep moving, keep moving, keep moving. With that, we're at exactly the top of the hour, so take care of your body, take care of your mind, take care of your spirit, take care of your health, do all the things that you need to do, and, you'll have less problems if you take care of things before it turns into a problem. Doesn't mean there might be some stumbles along the way. Things happen to us all. If you have chronic disease, if you don't have a chronic disease or injury, things happen in people's lives. So stay well, stay warm, stay safe. Don't forget, we have an educational preparedness book. I always like people to be sure and get that from the Reeve Foundation. I call it the book everyone should read. Nobody ever wants to use the information in it, but it tells you what happens how to be prepared for major catastrophes, like in the environment, all different kinds of things. There's a book about violence. What if you get robbed? Things happen. So those are books that you want to read. You want to know what's in them. You don't ever want to have to use them, but it's nice to know that you know. So with that, I'll say thank you very much, and I'll see you at the end of December.